Every single day, your body is fighting a fire you cannot see, cannot feel, and were probably never warned about. It doesn't hurt like a burn. It doesn't show up as a bruise. It shows up decades later as a stiff knee that used to bend without thinking, as a blood pressure number that keeps creeping up no matter what you cut back on, as a memory that used to be sharp, now reaching for a word that won't come. Doctors have a name for this fire. We call it chronic low-grade inflammation. And there is a simple blood test. It's called HSCRP, high sensitivity C-reactive protein, that can actually measure embers of it circulating in your bloodstream now. Most people your age have never had it checked. Most people your age have never even heard of it. And that is exactly the gap I want to close today. I'm Dr. CO, and for more than 15 years, I've practiced internal medicine while also working in nutritional biochemistry, which is really just a long way of saying I study what food does to the human body after it leaves the plate. Not the calories, not the diet trends, what actually happens at the cellular level, hours and days after you swallow. And after 60, few questions matter more than this one. What are you eating that is quietly protecting you? And what are you eating that is quietly working against you, one meal at a time, without you ever feeling it happen? Today, I'm giving you 7 foods, real, specific, ordinary foods you can put in your cart this week that have some of the strongest evidence behind them for lowering that silent fire I just described. And I want you to stay with me all the way to the first one, because it is a fat, a real fat with real calories, the kind you were probably told for 30 years to eat as little of as possible. And it turns out to behave inside your body almost exactly like a common pain reliever you probably have in your medicine cabinet right now. I'll explain exactly what I mean when we get there, and I change how you shop for groceries. Before I start the list, I want to be honest about something. I'm not here to sell you a supplement, and I'm not here to frighten you into a 12-week program. I don't have anything to sell you at all. What I have is the research, the actual published research. And my job today is just to hand it to you in plain language, the way I wish someone had handed it to my own parents 30 years ago. So let's talk about how this fire actually works, because once you understand the mechanism, every single item on this list will make sense instantly, instead of feeling like a random grocery list someone handed you. Inflammation itself is not the enemy. I need you to really hear that, because it gets villainized constantly online. Acute inflammation, the swelling around a sprained ankle, the redness around a cut, that is your immune system doing exactly what it's supposed to do. It shows up, it does its job, and it leaves. The problem isn't inflammation. The problem is inflammation that never gets the message to leave. As we get older, our fat tissue, our gut lining, our blood vessels can start producing a steady, low background hum of inflammatory signals, small proteins called cytokines, even when there's no injury and no infection to fight. This hum has a name research used constantly. Inflammaging. It's inflammation that comes simply from aging tissue, and it's now linked in a large and growing body of research to heart disease, to type 2 diabetes, to Alzheimer's disease, to osteoarthritis, and to several cancers. Not as a guaranteed cause, I want to be precise with you, but as a consistent, measurable companion to almost every major disease of aging we treat. So here's the one idea I want you to carry through everything I say for the rest of this video. 2 words: oxidative stress and inflammatory markers, that CCRP number I mentioned a minute ago. Oxidative stress is essentially rust forming inside your cells caused by unstable molecules called free radicals, and it's one of the main triggers that keeps that background inflammatory hum going. Every single food on this list today does at least one of 2 things. It either calms that oxidative rust directly, or it lowers those circulating inflammatory markers your bloodstream is producing. Some do both. Hold on to that, because I'll point it out every time. And here's the reframe I want you to sit with, because it's going to change how the rest of this video feels. Almost every piece of anti-inflammatory advice you've ever heard is about subtraction. Eat less sugar, eat less fried food. Eat less red meat, and that advice isn't wrong, but subtraction is exhausting, and it's not what today is about. Today is entirely about every item on this list, something you get to put on your plate, not something you have to give up. By the end of this, you're not going to feel restricted. You're going to feel like you were handed a toolbox you didn't know you had. Number 7, turmeric, and specifically the compound inside it called curcumin, and I promise this is going somewhere you won't expect. Curcumin has been studied extensively for its effect on joint inflammation, and several clinical trials, including ones published in journals of rheumatology, have found that curcumin supplementation can meaningfully reduce pain and stiffness in people with osteoarthritis, in some studies performing comparably to low-dose anti-inflammatory medication over several weeks. That's a real finding, not folklore. But here's the part almost nobody tells you, and it's the reason turmeric sits at number 7 instead of higher on this list. Curcumin on its own is absorbed by your body astonishingly poorly. You could eat a spoonful of turmeric powder and your bloodstream would barely register it. Fix is almost embarrassingly simple. Black pepper contains a compound called piperine, and research, going back to a well-known study in the journal Planta Medica, found that piperine can increase curcumin absorption into the bloodstream by roughly 2,000%. Not a typo. So the actual instruction here isn't eat more turmeric. It's whenever you cook with turmeric, add a real pinch of black pepper and a source of fat, like olive oil, in the same dish, because curcumin is also fat-soluble. A turmeric-spiced lentil soup with black pepper and a drizzle of olive oil is doing far more for your joints than turmeric tea made with hot water alone. And one honest caution before we move on. If you're on a blood thinner like warfarin, talk to your doctor before taking concentrated curcumin supplements specifically, since high doses have been associated with increased bleeding risk in some case reports. Food-level turmeric in cooking is a different story and generally not a concern, but supplements deserve a conversation with your physician. Number 6, blueberries. And I want you to notice I'm not saying berries vaguely. I'm naming this one specifically because the research behind it is unusually strong. Blueberries are loaded with compounds called anthocyanins, which are the pigments that give them that deep blue-purple color, and anthocyanins are some of the most potent natural antioxidants we've identified in food. They directly neutralize those free radicals I mentioned earlier, the rust-causing molecules behind oxidative stress. But here's why blueberries specifically earn a slot on this list, rather than just being a nice snack. The Rush University Memory and Aging Project, a long-running study following older adults, found that those who ate more berries, particularly blueberries and strawberries, showed a slower rate of cognitive decline over the following years compared to those who ate the fewest. The researchers specifically pointed to flavonoids, anthocyanins among them, as the likely mechanism, partly through reducing inflammation in brain tissue itself. I want to be precise here. This is an association found in observational research, not a guarantee that blueberries alone will protect your memory. But it's one of the more consistent findings in the nutrition and brain aging literature, and it costs you almost nothing to act on. A concrete number for you, about 3/4 of a cup, most days of the week, fresh or frozen. Frozen blueberries actually retain their anthocyanin content extremely well, so don't feel like fresh is required. Toss a handful onto oatmeal into plain yogurt, or simply eat them by the spoonful as dessert. I want you to stay with me because numbers 3 and 4 on this list are the ones I find most people get completely wrong. One because they've never heard of it, and one because they think they're already doing it correctly, and they're not. But first, number 5. Fatty fish on salmon, mackerel, sardines, and anchovies specifically, because the fat content is the entire point here. These fish are rich in 2 omega-3 fatty acids, EPA and DHA, and this is one of the best documented anti-inflammatory relationships in all of nutrition science. Ours the actual mechanism, and it's genuinely elegant. Your body uses EPA and DHA to activate specialized molecules called resolvins. Their entire job, as their name suggests, is to resolve inflammation, to actively signal to your immune system that a response is complete and it's time to stand down. Without adequate omega-3s, that stand-down signal is weaker, and inflammation can linger longer than it should. The American Heart Association recommends at least 2 servings of fatty fish per week for cardiovascular health, and multiple studies have linked regular fatty fish intake to lower circulating levels of that CRP marker I mentioned at the start. So the action here is concrete. 2 servings a week, about 3.5 ounces each, roughly the size of a deck of cards. If you're concerned about mercury, smaller fish like sardines and anchovies carry meaningfully less mercury than larger, longer-lived fish like swordfish or king mackerel. So they're an easy, affordable way to get there. And yes, canned sardines in olive oil absolutely count. And frankly, they're one of the best value foods in this list. Number 4, walnuts. And specifically walnuts, not almonds, not cashews, because the fat profile is different and it matters here. Walnuts are the only tree nut with a meaningful amount of alpha-linolenic acid, a plant-based omega-3, alongside a dense concentration of polyphenols. Research out of Harvard's T.H. Chan School of Public Health, including work connected to the long-running Nurses' Health Study, has found associations between regular walnut consumption and lower inflammatory markers, alongside better cardiovascular outcomes in people who ate them several times a week compared to those who rarely did. Again, associated with not a guaranteed cause, and I'll keep being careful with that distinction all the way through this video because it matters. The practical number here is small and easy. About 1 ounce, which is roughly a small handful, 7 halves most days of the week. Not a whole bag. This is a food where more is not simply better because walnuts are calorie dense, and if weight management is part of your health picture, that handful should be replacing something else in your day, a bag of crackers, a cookie, not stacking on top of everything you already eat. Number 3, and this is the one I promised you, where numbers 3 and 4 are the ones people get wrong most often. Because this one, people think they're already doing it correctly, and most aren't. Fermented foods. Kimchi, plain yogurt with live active cultures, kefir, sauerkraut. Here's why this earns a high spot on today's list. And I'll be honest with you, this is the part of nutrition science that connects most directly to how I was trained, because in traditional Korean thinking, there's an old phrase, yaksik dongwon, meaning food and medicine share the same root. Fermentation wasn't invented as a health trend. It was a way to preserve vegetables through a Korean winter, and it happens to produce something remarkable in the process. Fermented foods deliver live bacterial cultures directly to your gut, and a landmark study out of Stanford University, published in the journal Cell in 2021, actually tested this directly. Researchers put one group of adults on a high-fiber diet and another group on a diet rich in fermented foods, yogurt, kefir, kimchi, kombucha, fermented vegetables, for 10 weeks. The fermented food group showed increased diversity in their gut microbiome and, importantly, a measurable decrease in 19 different inflammatory markers in their blood, including one directly tied to rheumatoid arthritis severity. The high-fiber group, interestingly, didn't show the same inflammatory drop over that same window, which surprised even the researchers. The mechanism appears to run through your gut lining directly. A healthier, more diverse microbiome appears to keep your intestinal wall from becoming what researchers sometimes call leaky, which is when inflammatory particles can slip into your bloodstream more easily than they should. Here's your action. Aim for one modest serving of a fermented food daily, a quarter cup of kimchi alongside a meal, or a cup of plain yogurt with live cultures. And here is the honest caution I promised you at the start of this video, because I will never let a Korean food get a pass just because it's traditional. Kimchi can be quite high in sodium. A typical serving can run several hundred milligrams. And if you're managing blood pressure or kidney disease, that matters just as much as it would with any other salty food. Traditional is not automatically safer. Look for lower sodium versions where they're available, and let a quarter cup be your standard, not a side dish eaten by the bowlful. Number 2, leafy greens, spinach, arugula, and Swiss chard, specifically because of something inside them called dietary nitrates. Here is the mechanism, and it genuinely surprises people every time I explain it. When you eat nitrate-rich greens, your body converts those nitrates into nitric oxide, a molecule that relaxes and widens your blood vessels. Wider blood vessels mean lower blood pressure, and this is the part that ties directly back to inflammation. Chronically stiff, constricted blood vessels are themselves a driver of vascular inflammation. Research out of institutions including Queen Mary, University of London, has found that a daily intake of dietary nitrates from vegetables like spinach and arugula can produce measurable drops in blood pressure within just a few hours of eating them, and sustained intake over weeks has been associated with improved arterial flexibility. One study found roughly a 2-cup serving of nitrate-rich leafy green, enough to produce a meaningful blood pressure reduction in the hours that followed. Your action tonight, a real 2-cup serving of raw spinach or arugula, that's about the size of a small salad, not a garnish, worked into a meal cooked or raw, ideally with a bit of olive oil to help you absorb the fat-soluble vitamins riding alongside it. One caution that matters here, and I'd be doing you a disservice to skip it. Leafy greens are rich in vitamin K, and if you're on a blood-thinning medication like warfarin, sudden large swings in your vitamin K intake can interfere with how well that medication is dosed. The answer isn't to avoid greens. It's to keep your intake roughly consistent week to week and mention it to whoever manages your anticoagulation therapy. And if you're managing advanced kidney disease and have been told to watch your potassium, leafy greens are also a food to discuss with your nephrologist directly, because general advice like mine is never a substitute for advice built around your specific lab numbers.
Which brings us to number one, the one I teased you about at the very beginning, the fat almost everyone your age was told for decades to eat as little of as possible.
Extra virgin olive oil? Here's the story, because it's one of my favorite pieces of research in this entire field. In 2005, researchers, including Dr. Gary Beauchamp, published a paper in the journal Nature after noticing something odd. Fresh, high-quality, extra virgin olive oil produces a peppery throat-catching scent, almost like swallowing a small amount of a certain over-the-counter pain reliever. They investigated why, and they isolated a compound in the oil called oleocanthal. What they found was remarkable. Oleocanthal inhibits the same COX enzyme, cyclooxygenase 1 and cyclooxygenase 2, that ibuprofen inhibits. In other words, this natural compound in real olive oil works through a genuinely similar biochemical pathway to a common anti-inflammatory medication. I want to be careful and precise, because this is exactly the kind of finding that gets exaggerated online into something it isn't. Concentration of oleocanthal in a typical tablespoon of olive oil is far, far smaller than a therapeutic dose of ibuprofen. Researchers have estimated you'd need something like several tablespoons a day to approach even a fraction of a standard dose, and nobody is suggesting you replace your medication with a salad dressing. But as a small daily cumulative anti-inflammatory input layered on top of everything else you eat, it's a remarkable finding, and it's part of why extra virgin olive oil sits at the center of the dietary pattern. Researchers now most consistently associate with lower inflammatory markers, better cardiovascular outcomes, and, in some long-term studies out of Mediterranean populations, longer healthy lifespan. This is not marketing language. This is one of the most replicated findings in modern nutrition science. Your action here matters more than with almost anything else on this list, because quality genuinely changes the chemistry. Oleocanthal degrades with heat, light, and time. So look for a bottle labeled extra virgin, ideally in a dark glass bottle, ideally with a harvest date rather than just a vague expiration date, and use it generously, a real 2 to 3 tablespoons a day, drizzled cold, or added at the end of cooking, rather than used for high heat frying, where some of its beneficial compounds break down. Use it on vegetables. Use it on the leafy greens from number 2. Use it to help absorb the curcumin from number 7. It's not a garnish. It's the thread that ties this entire list together. This isn't fear, it's food chemistry. I want you to hear that phrase again, because I'm going to come back to it once more before we finish, and I want it to be the thing you remember when today's video fades from your feed tomorrow. So how does this actually work in real life on a Tuesday when you're tired and you just want dinner to be over? Here's the move I give my own patients, and I call it the anti-inflammatory bowl, because it takes 3 or 4 of today's items and puts them in one dish rather than asking you to remember 7 separate things. Take a base of leafy greens, spinach, or arugula. Add a serving of canned sardines or a piece of baked salmon. Drizzle it generously with real extra virgin olive oil. If you want warmth, a small side of lentils spiced with turmeric and black pepper. Finish with a small side of kimchi or plain yogurt. That's 5 of today's 7 items in a single 15-minute dinner. No special equipment, nothing exotic, nothing that requires a health food store. That's the whole secret. It's not about eating perfectly. It's about building one meal a day where inflammation-fighting foods are simply the default, not the exception. Let me tell you about a patient I'll call Robert, because his story is the reason I keep making these videos. Robert was 67 when I met him, retired, managing osteoarthritis in both knees that had gotten bad enough that he'd stopped his morning walks, and a CRP number that was quietly elevated on a routine panel his doctor had run. He wasn't overweight. He wasn't a smoker. He genuinely thought he was eating reasonably well. A turkey sandwich most days, some frozen vegetables, chicken breast a few nights a week. Nothing dramatically wrong, but also nothing on his plate that was actively working in his favor. We didn't overhaul his entire diet. We did almost exactly what I described to you. Olive oil replacing the vegetable oil he'd been cooking with. Salmon twice a week instead of one of his chicken nights. A small container of plain yogurt with berries most mornings instead of nothing at all. A quarter cup of kimchi added to his dinner most nights, which he genuinely grew to love. 3 months later, his CRP had come down meaningfully, and maybe more importantly to him, His knees felt different enough that he started his morning walks again, short ones at first. I remember exactly what he said to me at that follow-up appointment. He said it hadn't felt like a diet. It had felt like something he was adding to his life, not another thing being taken away. That sentence has stuck with me for years, and it's honestly the entire spirit behind this channel. Now, before I wrap up, I owe you the same honesty I'd want if I were sitting across from you in my office, because a video like this can't replace that conversation, and I'd never want it to try. Everything I've described today is based on published research and represents general population-level guidance. It is genuinely useful information, but it is not personalized medical advice, and it can't account for your specific labs, your specific medications, or your specific diagnosis. If you're on a blood thinner, please talk to your doctor before significantly changing your intake of vitamin K-rich greens or before starting any concentrated turmeric or curcumin supplement. If you're managing chronic kidney disease or you're on dialysis, several of today's items, leafy greens because of potassium, fermented foods because of sodium, deserve a direct conversation with your nephrologist or renal dietitian before you make them a daily habit, because the guidance that's protective for a general audience can be genuinely different for a kidney patient. And if you haven't had an HSCRP test done recently, it's a reasonable, inexpensive thing to ask your doctor about at your next visit. Not to self-diagnose anything, but simply to have a real number to track over time, the same way you track your cholesterol or your blood pressure. None of what I've told you today should ever be a reason to skip a prescribed medication, skip a screening your doctor has recommended, or assume food alone can replace treatment for a diagnosed condition. Food is a genuinely powerful lever. It is not the only lever, and I would be doing you harm if I let this video imply otherwise. Let's bring this all the way home with a quick recap, because I know 7 items is a lot to hold on to at once. For 7, turmeric with black pepper and a source of fat for joint inflammation. Number 6, 3/4 of a cup of blueberries most days for oxidative stress and brain health. Number 5, 2 servings a week of fatty fish like salmon or sardines for those resolving inflammation-calming omega-3s. Number 4, a small handful of walnuts most days for the same omega-3 pathway plus polyphenols. Number 3, a modest daily serving of a fermented food like kimchi or plain yogurt for your gut microbiome and those 19 inflammatory markers the Stanford research tracked. Number 2, a real 2-cup serving of leafy greens for the nitric oxide pathway and your blood vessels. And number 1, 2 to 3 tablespoons of real extra virgin olive oil daily for oleocanthal and that remarkable ibuprofen-like mechanism we opened with. If 7 feels like too many to start tonight, start with 3 extra virgin olive oil because it touches almost everything else on this list. Fatty fish twice this week and leafy greens with dinner tonight. Build from there. You don't need to be perfect by Thursday. You need to be a little bit better than you were yesterday, consistently for months, because that is genuinely how this works. This isn't fear, it's food chemistry. And chemistry rewards consistency far more than it rewards perfection. I'd love to know which of these 7 surprised you the most. Was it the olive oil? Was it the fermented foods? Was it something you're already doing without knowing why it mattered? Tell me in the comments. I read every one of them. Honestly, some of my best video ideas have come directly from questions you've asked down there. If this was useful to you, consider subscribing. This channel exists to hand you real-sourced information about healthy aging after 60 without the fear-mongering and without anything to sell you. And if you want to know what's quietly working against you instead of for you, stay close, because next week I'm walking through 5 everyday drinks that are quietly raising your blood pressure. And at least one of them is sitting in almost every refrigerator I've ever seen. I'll see you there.